Good morning everyone. Welcome back to channel Medical with Sanju. आजको क्वेशन प्रिक्लिम्सिया र एक्लिम्सियामा 20 वटा क्वेशन्स अलरेडी भइसकेको छ। रिमेनिङ क्वेशन हेरौँ। क्वेशन नम्बर 491. Acute condition characterized by convulsion and edema is option A eclampsia, option B epilepsy, option C preeclampsia and option D none of the above. Convulsion and edema eclampsia हुन्छ। Option A is right answer. Question number 492. Which of the following is not a feature of HELLP syndrome? Option A thrombocytopenia, option B eosinophilia, option C raised liver enzyme and option D hemolytic anemia. The full form of the HELLP syndrome is hemolysis anemia, elevated liver enzyme and low platelet count. Syndrome is a potentially life-threatening condition which is usually occurred in the last trimester of pregnancy. It is a laboratory diagnosis which indicates severe preeclampsia. Its complications are acute renal failure, disseminated intravascular coagulation, liver failure, respiratory failure, or multiple organ system failure. Option B is the right answer. Question number 493. Which of the below is not a component of HELLP syndrome? Option A hemolysis, option B bleeding per vaginum, option C low platelet count and option D elevated liver enzyme. Bleeding per vaginum is not HELLP syndrome. Option B is right answer. Question number 494. HELLP syndrome is a complication of option A hepatitis, option B AIDS, option C leukemia and option D preeclampsia. HELLP syndrome is a complication of preeclampsia. Option D is right answer. Question number 495. What complications should a pregnant lady be monitored for who has been admitted to the hospital with a diagnosis of severe preeclampsia in the last trimester? Option A evidence of paresthesia and purpura. Option B periods of a fetal movement followed by quiet period. Option C enlargement of the breasts. Option D complaints of feeling hot when room is cool. Option A evidence of paresthesia and purpura is right answer. Question number 496. Action of magnesium sulfate is option A CNS depressant and anticonvulsant, option B dietary supplement, option C muscle relaxant and anticonvulsant, option D CNS stimulant. Magnesium sulfate depresses CNS by decreasing the acetylcholine release from nerve ending. It is also block the calcium channel. Option A is right answer. Question number 497. The drug of choice in preeclampsia is option A dopamine, option B magnesium sulfate, option C sodium bicarbonate and option D sodium nitroprusside. The drug of choice in preeclampsia is magnesium sulfate. Option B is right answer. Magnesium sulfate MgSO4 7H2O is used as an anticonvulsant, which is a drug of choice used to manage pregnancy-induced hypertension and to help preterm labor. Question number 498. 16-year-old primigravida patient admitted with severe pregnancy-induced hypertension is given intravenous magnesium sulfate. The nurse should obtain which one of the following type of information? Option A, urinary output every 8 hours. Option B, deep tendon reflexes every 4 hours. And option D, respiratory rate every hour. And option D, blood pressure every 6 hours. Deep tendon reflexi हेर्नुपर्छ every 4 hours. Option B is right answer. Question number 499. A client with a pregnancy-induced hypertension is hospitalized and is receiving magnesium sulfate (MgSO4) by IV push. Before administering each dose, the nurse should assess the client's option A, temperature and pulse rate, option B, respirations and patellar reflex, option C, blood pressure and apical pulse, and option D, urinary output related to fluid intake. Option B is right answer. Question number 500. A nurse needs to check the most important parameter if patient is on a magnesium sulfate therapy. Option A, urine output more than 30 ml per hour. Option B, presence of a knee jerk reflex. Option C, respiration is more than 20 per minute. Blood pressure less than 140 per 90 mm of Sg. Option C is right answer. Question number 501. Which of the following noted on the assessment of a pregnant mother receiving magnesium sulfate for the management of preeclampsia determines that the client is experiencing toxicity? Option A, respiration of a 10 breath per minute. Option B, proteinuria of a 3 plus. Option C, presence of deep tendon reflexes. And option D, serum magnesium level of 6 mg per L. Option A is right answer. Question number 502. Magnesium sulfate IM is administered every 4 hours to an eclamptic client. Which of the following symptoms is an indication for the next dose of magnesium sulfate? Option A, absence of deep tendon reflexes. Option B, a respiratory rate of 16 per minute. Option C, urine output of 50 ml over the last 4 hours. And option D, complaint of being thirsty. Option B is right answer. Question number 503. A client is receiving magnesium sulfate therapy for severe preeclampsia. What initial sign of toxicity should alert the nurse to interview? Option A, hyperactive sensorium. Option B, increase in respiratory rate. Option C, development of a cardiac dysrhythmia. And option D, lack of knee jerk reflex. Option B is right answer. Question number 504. While monitoring a patient with severe preeclampsia who is receiving an infusion of magnesium sulfate, assessment reveals a pulse rate of 55 per minute, respiration of per minute, and a flushed face. The next priority actions would be option A, continue infusions and notify obstetrician. Option B, stop the infusions and start an infusions of a 5% dextrose. Option C, continue the infusions and document finding. And option D, decrease the rate of infusions and obtain a blood sample for serum magnesium level. Option B is right answer. Question number 505. Antidote used into toxicity produced by overdose of magnesium sulfate is option A, calcium carbonate. Option B, calcium gluconate. Option C, aluminum hydroxide, and option D, charcoal. Option B, calcium gluconate is the right answer. Question number 506. A pregnant client with preeclampsia is receiving magnesium sulfate. What should the nurse keep at the bedside to prepare for the possibility of magnesium sulfate toxicity? Option A, calcium gluconate. Option B, nalin. Option C, oxygen. And option D, suction equipment. The antidote of the magnesium sulfate is calcium gluconate. So bedside मा चाहिँ calcium gluconate राख्नुपर्छ इमर्जेन्सीको लागि. Question number 507. Which nursing diagnosis would receive priority for a preeclamptic woman who is 6 hours post-delivery? Option A, high risk for injury. Option B, sleep pattern disturbance. Option D, altered parenting. And option D, constipation. Risk for injury. Option A is right answer. Question number 508. Bed rest is essential in pre-eclampsia since it. Option A, prevent eclampsia. Option B, mobilize tissue fluid dured by lowering BP. Option C, improve blood circulations and decrease edema. And option D, prevent premature labor. Option C is right answer. Improve blood circulation. Question number 509. The importance of measuring the intake and output of a woman admitted with a toxemia of pregnancy is to. Option A, know the bladder is completely empty. Option B, complete the toxemia chart. Option C, ensure adequate intake of fluid. And option D, show the relationship between the intake and the output. Option D is right answer. Question number 510. A client is in the hospital undergoing therapy for severe pregnancy-induced hypertension. If eclampsia occurs, the nurse's first action should be to Option A, assess fetal heart tones. Option B, maintain an open airway. Option C, protect the client from injury. And option D, increase the infusions of magnesium sulfate immediately. Protect the client from injury. Option C is right answer. Question number 511. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following would the nurse obtain? Option A, oxytocin infusion solution. Option B, disposable tongue blades. Option C, portable ultrasound machine. And option D, padding for the side rails. इन्जुरीबाट बचाउनु छ. Protect the client from injury. So, padding for the side rails. Option B is right answer. Question number 512. A patient progress from preeclampsia to eclampsia. Nurse first action should be to Option A, administer oxygen by face mask. Option B, clean and maintain an open airway. Option C, administer magnesium sulfate IV. And option D, assess blood pressure and fetal heart rate. First priority is clean and maintain an open airway. Option B is right answer. Next question on APH. Thank you so much.